It is a great evening, and with a lot of different perspectives on technology, I thought I'll make a small change to the overall ethos of the discussion. So rather than sustainable cities, I sort of changed it to sustainable communities. And the reason I did that is I just want to talk about how implementing a digital solution or innovation in a rural kind of a setup is quite different from implementing in a city. And we firmly believe that implementing in a low infrastructure setup proves its capability of now growing it at scale, even in the urban areas. And keeping in mind that 50% of the globe is anyway rural, it's important that some of us sort of take that initiative to drive digital innovation in the rural parts of the globe. And today I will talk about some of the work that we've done in Papua New Guinea. These are the islands just above Australia. Pretty remote, but pretty interesting. And for us, when we went there about 3 years back, it was sort of an eye-opener because it was just about implementing in one of the hospital. But then the kind of impact that technology creates for really vulnerable people is quite interesting. And we sort of spent the next 3 years to really drive it across different parts of that country and making this as one of the sole provider of insights and medical information for the country. If you look at the ground reality, in PNG, largely if you look at the infrastructure, it is sort of ground zero. They have something called scale book, which is nothing but a small leaflet which sort of encompasses every visit that they make to the hospital. And most of the time, it sort of gets burnt or sort of getting destroyed. So imagine a pregnant woman spent a good amount of vaccination and medical history, everything written in that book, and then when they come to deliver at the hospital, those are lost. So these are the kind of challenges as a baseline. In terms of identity, not able to spell their name, no phone number, where today in India we're able to sort of put the phone number and take the history of the people, but then it's not there. So no clear identity. In terms of information, they're all kept in paper. The population health management of the country is kept in paper. So the consolidation and relating that to the overall impact geographically as well as within different provinces and different states is in there. And last but not the least, simple aspect of having internet. For us to be able to communicate, that's pretty low. And if you look at this aspect, it is no different, for example, in India as well. We are working with NIMHANS and Dementia India Alliance on the dementia, people with dementia, and they go sort of outside, just outside of Bangalore to do their camps and assessment, and similar challenges faced here as well. I just want to give you a picture of how a typical hospital in PNG looks like. It's sort of a godforsaken land, and then you see that the runway, because most of the places it's not motorable, so they have these small planes take care, take medicines to that, and these are the places that we sort of go. And honestly, like I said, each and every implementation brings us a sense of impact that we have created in the society. And for us, digital innovation has to create that positive impact in the society. If you look at the foundational aspect, we need to have systems that are offline first, because it is not about whether you have internet or whether you don't have internet. It is about sustained, constant internet. And most of the hospitals, even here when we go and implement large hospitals, the doctors are quite not so happy with the system, because every time the internet drops, they are not able to sort of enter the data, or they lose all of the data that they've entered. So system should have first an offline capability. Second one is structured data. We talk about various AI that is being sort of built on top of system or individually, but without structured data, it is a key concern. And for good or bad reason, 80 to 90% of health data are unstructured. So how do we sort of build that system where it collects structured data? Ensuring that it is secure, and the aspect of privacy, specifically the confidentiality of patient information. And last but not the least, ensuring that very simple UI factor for the nurses or those who do not have as much of computer literacy being able to use the system. So what we did was sort of built 3 layers. So the first layer is to ensure that the digital aspect replicates their paperwork, because you don't want to change the process of that country. So all of different workflows, different process flow across different disease management, we sort of digitize it. We used click-based rather than typing, because the ability for them to type is quite difficult. So just click-based, which people are used to using smartphones, and then also using speech to text. So like Siri or Alexa, the system responds to certain commands, and you're able to sort of speak and document it. And the middle layer of the core intelligence, because in PNG you don't have a standard name or a phone number that they can sort of carry, which the record management can sort of pull up the records. So we use biometric as the key identifier. So irrespective of which hospital or which health post they go to, you use their biometric for us to be able to pull up the records. The other aspect is inventory, and inventory not within the hospital, but also the drug dispensation across the country. A small health post in a very, very remote area, if they need to service a smaller community, they need to have that much of drugs, they need to have that much of vaccine. So the system provides that insights about the need, the demand, as well as the supply across the country for various inventory related to medical. The other aspect is device to human interface. So we provide telemedicine, but also linking the electronic system to devices, whether it is a lab device or whether it is an imaging device, so that you have everything in one system. Because even in India or even in the Western world, each hospital might have anywhere ranging from 10 to 40 different systems. And imagine trying to sort of get all of that together to be able to service the patient. The infrastructure, again, like I said, offline first needs to be light, and then also linked to the national system, because the data that gets curated needs to sort of provide a well-rounded information for the country, so that they're able to take the right kind of decision in terms of policy as well as procurement as such. The other aspect that I would like to sort of focus is specifically in the rural areas. For them, it is not financials, it is about disease management. The difference I see when it comes to the urban area, where most of the systems are not used for disease management, but rather for financial management. But when you go to the rural parts, the focus clearly is disease and very, very specific disease-specific workflow. And for example, one of the key areas that they sort of focus on is the neglected tropical diseases, and one of them is sort of leprosy. And if you see the care provided for an individual with leprosy, it starts off with the community health post in the very remote area. And then they sort of come to the health center and to the hospital to sort of get their regular medication. And if the entire ecosystem is not connected and provided for, it becomes a big challenge to sort of eliminate diseases like these. And within the system, what we also do is to drive for automatic algorithms, so that disease diagnosis sort of is provided by the system, rather than low-skilled, low-educated nurses or health workers in the community, so to say. Pass this slide. And then one of the key aspects that a system like this needs to provide for is to sort of give insights, both GIS-related insights as well as graphical, because the information that gets tracked in different parts of the country, whether it is a health post or whether it is a small health center or hospital, all of this needs to get consolidated. And right now, the government uses this system to sort of do the procurement and dispensation of vaccine, of medicine, as well as to be also allow the manpower management across the country. So these are the kind of critical data that gets captured and being able to sort of provide impactful and sustainable aspect in the community, specifically in the rural area. And like I mentioned, the impact of PNG or any rural parts of the globe is something that can be absolutely replicated in the rural parts, in the urban parts as well. And that is what we're working with NIMHANS and Dementia India Alliance on the dementia track, and similarly on various other track on cardiology and mental health. And we're seeing that a simple system that is able to get integrated as well as provide the right insight is something is the need of the hour, rather than large-scale, siloed AI interventions, so to say.